Oxidative therapies consist of a category of therapies that obviously from the name use oxygen. And the main focus of using them in the body is to create what I call a free radical storm. And the reason for this free radical storm is that cancer cells do not know what free radicals are. The burning of sugar without oxygen that takes place in the cancer cells does not produce what's called free radicals. Free radicals are free floating oxygen molecules that are looking for something to react with. And so our normal cells create free radicals as part of their own energy production. So they have been forced to develop mechanisms to neutralize the toxicity of these free radicals. And they do that with a compound called an antioxidant. Very commonly used term. But cancer cells do not produce free radicals. So they don't know how to deal with them. And in fact, they can be killed by certain levels of free radicals because they do not have antioxidant pathways in them. RIMC offers a number of different ways of applying oxidative therapies. We first use free medical grade oxygen coming out of an oxygen tank. Many people are familiar with that technique of just breathing pure oxygen. But also there is the use of intravenous hydrogen peroxide and the use of ozone gas introduced into the blood by various safe mechanisms to produce this oxidation, and also ultraviolet light exposure to blood, to a patient's blood, through different techniques. We have two different specific ways of doing that therapy. And all of these therapies produce an oxidative effect. And as I said, that's the production of free radicals. And the key thing about free radicals is it not only will kill cancer cells, but it will kill viruses and bacteria as well.